There are 3 degrees of lateral ankle sprains. The first degree is when there is very little torn tissue and the pain and swelling is mild. Joint stability is still good and it can take about 1 to 3 weeks to recover. The second degree is when there is up to 50% of the ligament torn but no more. The pain and swelling is moderate. The person may have trouble walking. The estimated time for recovery in this period is 3 to 6 weeks. The third degree is when there is more than 50% of the tissue torn or a complete rupture. The joint will be unstable and unable to weight bear. In this degree, it can take several months to recover. When the ankle is first injured and during the early stages of rehabilitation, Rice protocol should be followed. This means that the ankle should be rested with ice applied in order to support the blood to flow towards the ankle, which will help with pain relief and for the joint to heal. The ankle will be compressed by a bandage or a sleeve and allowed to elevate. Another early rehabilitation protocol which follows similar steps is PLEACE. This stands for protection of the joint and optimum lifting, meaning to apply as much pressure as comfortable for the joint without causing pain in order to keep some strength in surrounding muscles. It is important in the early stages when the joint is being rested that there is still some level of exercise to be exerted onto the joint in order to undergo repair. In the early stage is range of motion exercises are used firstly to see how much pain-free movement there is and how much the sprain has impacted the range of motion of the joint. Range of motion benefits the joint by allowing the client to move the foot freely and show how much mobility is still there and pain-free before moving on to isometric exercises where there is a force being exerted against the joint in order to rebuild strength. It is important to practice inversion and eversion freely before moving on to isometric, as this is the part where the joint is most sensitive and needs monitoring how much mobility is present. During isometric exercises in this stage, the client will follow the same patterns as they did through the range of motion exercises. The only difference will be that a force will be applied against the motion of the ankle in order to strengthen the muscles. This will engage all of the muscles and redevelop them a lot faster.
Now?
Okay, so push against my hand. That's it. And the other way. And this way. Good, and that way. And we'll start again. And the other way. This way. And inwards. Good. For cardio during the rehabilitation of the joint, I would recommend for the client to, in the early stages of rehabilitation, to participate in swimming, as it is a non-weight bearing exercise because the water is used to support the body. This can be done for around half an hour to an hour 3 times a week or more at the discretion of the client and the severity of the injury. In the intermediate stages of rehabilitation, I would recommend the cardio to be cycling, as this puts more pressure on the joint and supports the ankle to strengthen. Okay, so you hold on to the bands and extend your foot and release and extend again and release and extend, and we'll do this 12 times for 3 sets, but for the sake of recording we're only going to do 6 repetitions, and if it's too easy you could pull on the band harder. Okay, perfect. Okay, so you hold on to the calf raises are the eccentric loading of the ankle as the muscles are extending around the joint. In order to make this exercise harder, the client can push down on the knees to create more tension until they are ready to perform this exercise standing. Another variation of this exercise could be using the feet to move around the joint. Eccentric loading of the intermediate stage, so we will do calf raises. So the client will raise up his ankle and drop and extend and drop. We'll show one more, and then can you put your hands on your knees and press down. That's it, just to cause more tension. And to progress this further we can move in feet motions to strengthen the ankles further, so keep going that way, that's it, and come the other way, that's it, and then we can progress this into standing at a later point. In the intermediate stage of rehabilitation, the squat can be used to rebuild strength of the ankle at the same level for each leg. During the first stage, it may be that the injured ankle cannot withstand the same pressure as the other ankle, but with implementing the body weight squat, it can slowly rebuild at the same level. If the person cannot manage 12 repetitions, I would recommend to do wall sits for 30 or 60 seconds 3 times. Okay. Whilst the ankle is still in the injured stages, it is important to make sure that during the squat, everything in the hips and the knees are in line, as this can be a sign that the client is overbearing on one side. Want to go again? Try not to hit your head. Try and lift your back against the wall, that's it. And wiggle your toes, yeah, that's it. If you're feeling too much pressure on your ankle, try and move your feet forward. Okay. Okay. Whilst the ankle is still in the injured stages, it is important to make sure that during the squat, everything in the hips and the knees are in line, as this can be a sign that the client is overbearing on one side. Lunges are a good exercise for the ankle as it uses a lot of muscles in the leg. In particular, the gastrocnemius and soleus are used in the calf, which benefits ankle redevelopment. I would recommend doing 6 for each leg in 3 sets, but if this is too difficult for the person, I would suggest to stay in the same position for 30 seconds on each leg. This supports isometric movements, which is good for the joint. Okay, and step the foot forward when you've finished. And then we'll go backwards. That's it. One more. Good. Okay, and if this is too painful, just keep in the same position. So hold the lunge position.